was tackled, and I was holding on to the football so I wouldn't fumble it. And then one guy tackled me, and then another guy jumped on top of me and smashed my chin off the turf.
Okay.
I kind of went like chin first, and that's when the pain first started.
Okay. So you hit. So that was exactly a week ago, or
probably. To be honest with you, I can't remember exactly what it was.
About a week. And you hit with your chin first.
Yep, chin strap to the turf.
Just kind of straight on, and it hyperextended you that way, kind of thing.
I'm pretty sure.
Hard, but during something crazy like that, it's probably hard to tell what exactly happens.
Yeah.
But you had the helmet on, and there was a trauma that caused it. After that, immediately the chin's hurting, or?
Yeah, it's like stabbing pain, like right in the side of it, right, like where my ear is. Inside,
okay.
like,
so it's only the left side?
Only the left side, yeah.
Pain goes anywhere else? It goes up, it goes down?
No, it's just right there.
Okay, and it hurts to move the jaw?
Yeah, to move it that way, not so much the other way, and to open and close.
Okay.
Biting down is what hurts the worst. So if I like take a hit to the head, which happens often, and I bite down, I clench my jaw.
On your mouth guard,
yeah.
You're probably clenching a lot. And so eating hurts?
Yeah, eating hurts a lot.
Do you have to eat like different things, or can you get through it? And
I usually get through it. Probably after one time of it really hurting bad for probably about 15 seconds, the pain will kind of subside enough for me to eat.
You do it, okay, so you start chewing.
I kind of like warm my jaw up.
It gets warmed up, and then it's more tolerable.
Yeah.
Okay. But it hasn't been changing or improving just naturally.
It's just the same.
Since it's happened. So biting and clenching was something that you do when you eat and when you play football or when you get hit. Okay. Neck's okay? You're not noticing neck stiffness or anything? Like you've had that in the before? It doesn't appear there's anything happening there. And you have symptoms only with that. It doesn't come. If it comes on, does it stay on?
It'll stay on for about 15 to 20 seconds, and it'll like.
Not for all day kind of thing. It's killing you. Have you tried anything to help it?
Tried moving my jaw around. I tried like just moving it side to side, opening and closing, trying to just keep it warm. That's
just general movement, all directions kind of thing.
Nothing crazy.
You haven't gone after one specific movement like we've done with some of your other. All right, so I think just like we saw before, we're gonna see how you're moving, see if it's tight in any direction, see if it's painful. Well, we already know it's painful in certain directions, and then try to find a movement that helps it. We already know a couple that usually help with it. Mm-hmm. We get changed today. That's what you do. Check in a couple days. We don't get changed today. We test the movements most likely to help with it. So let me see you open it as far as you can, and okay. That's normal for you, or so that's your normal ability to open, and it hurts to do that.
Yeah, it hurts right when it unlocks is when it hurts.
So not when you get to the end.
No, not when I get to the
end. Just the initiation.
Just getting up there.
Okay. And then when you clench it like that, and that's right in that joint. Okay. And it can go into the ear.
Yeah, that's when it's
it doesn't
tense.
It doesn't go anywhere else.
No, the worst the pain's right in there.
Okay. And then let me see you go. Let's go to the right first. But I'm just kind of watching for how far your teeth cross there. So, okay. And that hurts same spot?
Yeah, a little bit.
Not as bad as opening and closing?
Not as bad, no. Okay. Going the other way doesn't hurt at all.
And then go the other way as far as you can. And just keep your ear open a little more. Okay. And that look about the same as far as you can move it to me. And it doesn't hurt that way, a little bit that way. More opening and closing pain. Okay. And then you tried moving it that way.
Yeah.
Just take it, just kind of push it back that way. Almost like you were to do circular traction.
Yeah, it hurts.
Just doing that direction?
Yeah.
Like that helps it. A few of those actually. So it's gonna be, just maybe guide it with both hands, just straight out like that, and then off. And then out like that, and then off. I guess give us a number of what it was before when you first bit. I think on your intake you said it's about an 8 with these things.
When there's trauma, like if someone comes and hits me in the head and I bite down as hard as I can.
Okay. I guess when you came in before we did that initial open, what would you call that? And then what is it after?
About a 6. Now
and then down to
a 0, maybe a 1. I can feel it, like I know it's different.
Like a remnant, but the biting still hurts.
Yeah.
Okay. Give it more. If we do get pain with it, and then it's okay after, as you know from previous stuff, that's okay. But give me about 10 of those, just all the way out as far as you can take it. And then off. Not a ton of movement at the joint. Okay. After doing 10 of those, just check opening and closing again.
Yeah, it hurts a lot less.
Less. Okay.
Biting down still have it. It still hurts, but opening up doesn't
The
hurt.
initial opening. Another set of 10 or so. Probably 80%. Just try opening it again. What do you got?
It's good.
Try closing it again.
I still got it.
What's happening there?
I don't have any pain moving side to side, just
Okay.
closing down.
So the side motion's good and the opening motion's good.
Yep.
But the biting still bothers it.
Alright, so I'm just gonna stabilize you there so I'm not moving you.
Mhm.
And then just, why don't you help bring it out. Maybe a little bit more, and then off.
Yeah, I heard a pop the second time you did it.
Okay.
Yeah, it feels a lot better.
So all the other ones are good and the closing's getting better too.
Closing, it's better.
So that's going to be your move, called just protrusion. Straight out like that.
Yep.
And you just kind of intuitively grabbed it on the other side and guided it out like that. So
That's the best.
that was going to work the best. Load it up every hour or two for the next couple days. Does your helmet by any chance push you that way? Is there anything else like in football that
chin
would
strap.
push you that way?
Yeah,
I guess if you can or if it's safe, try to not let it do that to you.
Mm-hmm.
You know, because the opposite direction often makes it worse.
Okay.
Just like other joints that we've seen with you, if you push it the wrong way, it gets worse. If you push it the right way, it gets better. So anything that's going to do that, which a chin strap probably would,
Yeah.
just kind of loosen it, or you can.
Yeah.
You
I
can
can
do
do
that.
that. I can loosen it.